The debate over assisted dying in the UK has reached fever pitch. Within the NHS, healthcare professionals are grappling with the potential ramifications of legalizing this practice. The central issue is whether terminally ill patients should have the right to end their lives with medical assistance. This debate raises complex ethical, practical, and emotional considerations for doctors, patients, and society as a whole. At the heart of the matter lies the fundamental principle of patient autonomy. Proponents of assisted dying argue that individuals should have the right to make decisions about their own bodies and their own deaths. They emphasize the importance of alleviating suffering and allowing patients to die with dignity on their own terms. However, opponents raise concerns about the potential for coercion and abuse. They argue that vulnerable patients, particularly those who are elderly, disabled, or suffering from mental health conditions, may feel pressured to end their lives prematurely. The potential impact on palliative care is another major concern. Critics worry that legalizing assisted dying could divert resources away from palliative care services, which focus on providing comfort and support to dying patients and their families. The debate over assisted dying is deeply personal and often emotionally charged. It is a debate that forces us to confront fundamental questions about life, death, and the role of medicine in society. As the debate continues, it is essential to approach this complex issue with sensitivity, compassion, and a commitment to finding solutions that respect the dignity and autonomy of all involved. One of the most contentious aspects of the assisted dying debate is the difficulty of accurately predicting a 6-month prognosis. This time frame is often used as a benchmark for determining eligibility for assisted dying, but it is notoriously difficult to predict with certainty. Doctors rely on their clinical judgment, experience, and available medical evidence to make these prognoses, but there is always a margin of error.
The consequences of an inaccurate prognosis can be profound. If a patient is deemed eligible for assisted dying based on an inaccurate 6-month prognosis, they may end their life prematurely. Conversely, if a patient is denied access to assisted dying because their prognosis is deemed to be longer than 6 months, they may experience unnecessary suffering in their final months of life.
The challenge of predicting prognosis is particularly acute in cases involving degenerative illnesses, such as motor neuron disease or multiple sclerosis. These conditions can progress unpredictably, making it difficult to estimate life expectancy with accuracy. Patients with these conditions may face a cruel dilemma: apply for assisted dying too early, before their suffering becomes unbearable, or risk being deemed ineligible later on when their condition has deteriorated further. The inherent uncertainty surrounding prognosis raises serious ethical concerns about the use of a 6-month criterion for assisted dying. Critics argue that this arbitrary timeframe fails to account for the individual circumstances of each patient and their experience of suffering. They call for a more nuanced approach that considers the patient's overall quality of life, their values, and their wishes for end-of-life care. Within the medical community, there is no consensus on assisted dying. Healthcare professionals hold a wide range of views on this complex issue, reflecting their personal beliefs, professional experiences, and ethical frameworks.
Some doctors believe that assisted dying is a compassionate response to unbearable suffering and should be available to patients who meet strict eligibility criteria. They argue that it is a fundamental part of patient-centered care to respect a patient's right to make decisions about their own death.
Other doctors strongly oppose assisted dying on moral, religious, or professional grounds. They argue that it is never permissible for a doctor to intentionally end a patient's life, even if the patient requests it. They express concerns about the potential for abuse, the slippery slope argument, and the impact on the doctor-patient relationship.
Many healthcare professionals fall somewhere between these two poles, acknowledging the complexity of the issue and the validity of arguments on both sides. They may support assisted dying in principle, but have reservations about its practical implementation or the potential for unintended consequences. They may also express concerns about the lack of adequate palliative care services in some areas, arguing that patients should have access to high-quality end-of-life care before considering assisted dying. The diversity of opinions within the healthcare profession reflects the complexity of the assisted dying debate. It is essential to create safe spaces for healthcare professionals to engage in open and respectful dialogue about this challenging issue. This will require a culture of transparency, empathy, and a willingness to listen to and learn from different perspectives. This includes ensuring adequate funding for palliative care research, training, and service provision, as well as promoting public awareness of the benefits of palliative care and its role in providing holistic end-of-life care. In jurisdictions where assisted dying is legal, there have been various outcomes and lessons learned. Some regions have reported an increase in the quality of palliative care services, driven by heightened public and professional awareness of end-of-life care needs. Other areas have faced challenges in maintaining a balance between providing high-quality palliative care and offering assisted dying as a legitimate option. It's clear that the implementation of assisted dying laws requires careful consideration of local healthcare contexts and robust oversight to ensure that all patients receive compassionate and comprehensive care. The debate around assisted dying underscores the need for robust safeguards and patient-centric care. Safeguards are crucial to protect vulnerable individuals and ensure that decisions about end-of-life care are made with the utmost integrity and compassion.
It's essential that any legal framework for assisted dying includes stringent criteria and oversight mechanisms to prevent misuse and ensure that patients are making informed, voluntary choices.
We must also ensure that palliative care services are adequately funded and accessible to all, so that no one feels pressured to choose assisted dying due to a lack of alternatives.
Ultimately, the goal should be to create a healthcare system that respects patient autonomy while providing comprehensive support and care at the end of life. This means fostering a culture of compassion, investing in palliative care, and ensuring that assisted dying, where legal, is implemented with the highest ethical standards.